So, first case. These are your options. 53-year-old man with right lower quadrant pain. So, let me just make sure this is the right case. Yeah.
So this is for the UCSF fellows and residents.
This was the given history, and this patient is in the ER. So 3 cases of right lower quadrant pain. This is your first case. Okay, I'm gonna take a guess. I know you probably scratch your head a little longer than what I'm showing you here, but
Mark, Sean.
They're muted.
Oh yeah, sorry. I'm muted now.
okay. All right, audience. A, B, C, or D?
Does the patient have fever or leukocytosis?
A slight leukocytosis. I don't remember about the fever.
I don't see anything specific for tuberculosis.
Yeah, that's probably not the answer. Okay, so this case was thought to be perhaps related to the appendix, but if you look carefully, the appendix is here, and I guess the history is biasing, but this actually ended up being cancer, and if you look carefully, there's probably, this is the primary gastric cancer. So although initially thought to be perforated appendicitis, the next day there's teams consulting with more experienced readers and thought this was likely going to be tumor. And on biopsy, this was a gastric adenocarcinoma.
So is that just a peritoneal deposit?
Yes, it's just carcinomatosis, and somehow this patient just presented in the ER.
Wait, Victor.
Yeah.
It didn't say gastric necessarily. It said mucinous with signet ring. So why couldn't this be appendiceal cancer that ruptured? And because that stomach deposit to me looks more like it's on the outside of the stomach.
That's true. I'll have to double check, but
yeah, I dispute this case.
Okay, I have to make sure, because I think
it doesn't. I agree. It doesn't look like a mural or mucosal lesion of the stomach wall, does it? It looks
that's
like
true.
It's extramural.
Just assume that the signet ring meant gastric.
Yeah, you can get that in appendix, colon, and it's a bad prognosis.
But the appendix here looks pretty thin.
But I feel like the end is ruptured, like that. It's like ruptured into that mass down there.
Yeah, I thought it was.
I'll check the endoscopy report, and this is just a hemangioma. Okay, this next case, that's a good point. I'll check. This next case, I couldn't get to anonymize, so here it is: a 56-year-old man with right lower quadrant pain. And this was the first scan that was obtained. It's a non-contrast scan.
Quite a bit of abnormal looking bowel.
Yeah, super thick.
Yeah, a lot of inflammation.
Yeah, so we said this could be some small bowel ischemia, or there's a lot of inflammation. Okay, let's see. Here's a post-con scan that was obtained 2 hours after.
Could be IBD.
That'd be a pretty bad case of IBD.
So an NG was dropped, and still see a lot of stranding. So, okay.
More of a differential than a diagnosis.
Mhm.
So here, yes, a differential. But in retrospect, I think we may have seen this.
There were some calcifications in the liver somewhere. I mean, those could have been just sporadic, but I don't
think
see any
those-
calcifications in the mesentery.
Yeah, I think those are just dystrophic. All right, time to take a guess. A, B, C, or D? Well, there's definitely some C,
Yeah, definitely is possible C.
but that's what we thought was the inciting cause. In retrospect, though, you could see that there the tip of the appendix is actually just blown out. So this is just a case of severe peritonitis here from a perforated appendicitis. And this patient ended up developing abscesses 5 days after. This is a pretty difficult case of perforated appendicitis, and shown this a couple times to other faculty. Basically, nobody gets it right first time.
The cases that I've seen where the appendicitis becomes a case of mesenteritis and peritonitis that's this extensive, more commonly in patients that are immune compromised in some way, or diabetics, or on steroids, because most people wall it off and end up staying more localized.
That's true. I'm not aware of any of that history in this patient, so it's just kind of unusual. But he did develop many abscesses in the 1 month that he was here. So. All right, last case. This person is 101, and she has this scan. Also has right lower quadrant pain.
Looks like my case.
Cancer.
Kind of looks like a mass in the right lower
Yeah.
quadrant.
With his-
Soft tissue mass that looks like it's maybe of the
Wait,
right
and is
colon.
it like fistulized with the bladder?
That's
Yeah,
right. Yeah,
like
so,
like a ulceration into the bladder.
I guess this is not that difficult, but I think many people would think that this is some sort of perforated appendicitis or some infection. But yes, this is a mass, and it's fistulized to the bladder. And so this is a blowout abscess in this really elderly woman. So it's a blowout abscess with tumor adherent to the bladder.
Is that a known terminology? I'm not too familiar with blowout.
I've seen it used before, and
Okay.
it does refer to this kind of abscess where there's so much pressure from a obstructing cancer, they develop an abscess.